Beautiful Tuesday morning, Tuesday the 17th of March 2026. You're tuned to Women Radio 91.7 FM, the voice of women, Nigeria's first and only radio station for women and their families. And this is Radio Doctor, Nigeria's first specialized radio health program, where medical doctors consult and advise for free on radio. Broadcast 10 a.m. through Mondays through Fridays. And today we have our radio doctor, Dr. Collins Aboloje. Good morning, Dr. Collins. How are you?
Good morning. Good morning. I'm doing good. How are you?
I'm good. Oh, I'm good. It's been a while. It's good to have you back.
Yeah, it is. Well, thank you. It's always a pleasure to be on the program.
Yes. Dr. Collins is an assistant medical director and fertility physician at St. Ives Specialist Hospital in Abeokuta. We are live on YouTube at WFM 917. The phone lines are open. You can call, actually, the phone lines are not open. The text and WhatsApp lines are open, 0703-1756-537 or 08155-917-917. The phone lines will be open shortly. You can also listen to us on the go via our website, www.wfm917.com. This morning, we are going to be talking about sexually transmitted diseases and infertility. I'm going to say that again. Sexually transmitted diseases and infertility. So let's get into it. Dr. Collins, could you explain to us what sexually transmitted diseases are and why they are a major concern for reproductive health? Hi, Dr. Collins. Is Dr. Collins muted? I can't hear you, sir. I don't think he is. No, I cannot hear you. Benjamin, is there a problem? Can you hear him in the studio? No, I think... Are you connected to a Bluetooth something? Yes, if you're connected to Bluetooth, then maybe that's what it is.
Can you hear me now?
Yes, I can.
So that means there's something wrong with my Bluetooth. Okay, so that's fine. All right. So sexually transmitted infections are simply infections that are transferred from one person to another via sexual contact with bodily fluids. Okay? Bodily fluids in this case would be blood, semen, and vaginal discharge. And we have to know that sexual contact is not only vagina, it's not only limited to the vagina. It could be anal, or it could even be oral sexual contact or sexual intercourse, as the case might be. So we've seen that roughly 1 million persons get infected with sexually transmitted infections on a daily basis. And we've seen that these happens and we can also say that about 20% of women of reproductive age get infected with sexually transmitted infection. And some of these infections have the capacity to cause pelvic inflammatory disease, which can cause infertility again in 20% of cases. Okay? We've seen that the commonest sexually transmitted infections that we have in our environment include infections with chlamydia, syphilis, gonorrhea, and of course with the other, the one that is quite common to a lot of people, which is the HIV. Okay, but then there are still some others, which include herpes, hepatitis, and the human papilloma virus. Okay, there are even some parasites that can be sexually transmitted. Examples include trichomonas and scabies. Okay, so the risk factors. So there are certain people that are at risk of having sexually transmitted infection. Number one are women, or well, not just women actually. So let me use the word people. Okay, both men and women, because men cannot be excluded from this discussion. Oh yes. So both men and women that are between the ages of 15 and 29, because really at this particular age, a lot of people are very, very sexually active. Secondly, people having multiple sexual partners. The third, people engaging in unprotected intercourse. I mean, for some persons, I mean, they are doing the wrong thing, but they are doing the wrong thing the right way. So if you get me, if you get what that means, having multiple sexual partners, but then they are they are having protected sexual intercourse. So that is doing the wrong thing the right way. So that, I mean, we can give those people some kudos, I mean, for being wise a little bit. So, but then if you have unprotected intercourse with multiple sexual partners, then you stand a very high risk of having sexually transmitted infection. For some other persons, could even be via a procedure, especially in the case where maybe they go to a facility where they do not engage in the regular in the standard practice, okay, where they use one material for one person and use it for another, okay. So that can also be an avenue or that puts people at risk of having sexually transmitted infection. Now, we have also seen certain ways in which people get infected. So I will just, earlier I said it is due to exposure to bodily fluids, be it blood, semen, or vaginal discharge. So, but we've also seen that people who engage in maybe drug abuse, so they use needles, you know, this person uses it, another person uses it to inject all their whatever they inject into their body for their euphoria and all the whatnots. Okay, so needle reuse is a means through which people can get infected with sexually transmitted infection. Then mother to child during labor, especially for a woman who has one sexually transmitted infection, they can easily pass it to the child during labor. So that is one means. For some other persons, could even be by touching, skin to skin contact. Yeah, some people will be like, but there's never been anything that says that skin to skin can actually. When I mean skin to skin, I'm talking about body skin to the skin of another person. Okay, for people who have dirty minds, you just take their mind out of the water on that one. So we're talking about skin here. Okay, so the skin. So maybe for certain people, they have conditions like hepatitis can be notorious to be transmitted even through sweat. That has to be one. Oh yes, it can be quite a strange way to transfer a sexually transmitted infection, like the hepatitis. Yes, especially for people who are very, very, they are very infectious. Maybe the virus has actually overwhelmed their body, so they are quite infectious. So at that stage, if another person has a cut on their skin and they come in contact with the sweat of that person, can actually get the hepatitis. Okay. So these are some of the means. Then, like I said earlier, through intercourse. So I think I'll just stop here for now to allow the conversation progress smoothly.
Okay, so how do STDs affect fertility in both men and women? Because that's what we're linking STDs and infertility together.
Yes. So, like we said earlier, STDs or STIs, as the case can actually result in what we call pelvic inflammatory disease. Okay. So, when it causes pelvic inflammatory disease, like we know that chlamydia and gonorrhea are very notorious bacteria that can actually cause pelvic inflammatory disease. Pelvic inflammatory disease is simply an infection of the upper genital tract. So, the upper genital tract in a woman now, in this case, comprised of the uterus, the tubes, and the ovaries. So usually these pelvic inflammatory diseases that are caused by chlamydia and gonorrhea can affect those structures, okay, that I just listed now. The very notorious one is the tubes. In fact, the tubes are commonly affected in a woman that has pelvic inflammatory disease because this organism can cause what we call tuber scarring. Tuber scarring is like they can cause inflammation inside of the tube, and then you can see scar tissue formation inside of the tube. When this scar tissue forms, it prevents the meeting of the egg and the sperm. When a woman ovulates, the egg comes into the tube. The sperm has to swim from the vagina through the uterus down into the tube, okay, to meet with the egg. But because of the presence of a scar tissue in there, it will act as a
barrier.
Yeah, barrier. Okay, so preventing the union of the egg and the sperm. So as a result, the woman will find it difficult to get pregnant. And like we said, it doesn't even end there. It's also important to note that people who even have pelvic inflammatory disease that is caused by sexually transmitted infections, they have a 9% chance of having future ectopic pregnancies. You know, when we said that there could be scar tissue formation inside of the tubes, this scar tissue can also prevent the moving of the embryos from the tube into the inner lining of the womb. Yes, so this can result in future ectopic pregnancies. So usually this is how it does that. But now let's come back to the question. So this is on the part of the woman. So basically what sexually transmitted infections do in women is that, number one, they can result in what we call chronic inflammation. Chronic inflammation in this case will not be like in the form of endometritis, laryngitis. So all this chronic inflammation can be found in all of these structures that I listed earlier: the uterus, the tube, and even the ovaries. Okay, and of course, basically this can affect the proper functioning of the body and will not even allow an embryo to implant, or even an egg or an embryo to even be formed, because of scar tissue that will be formed in the tube. Okay, it can result in vaginal discharges, can result in chronic pelvic pain that could even lead some people to have an aversion for sex, you know. So these are some of the ways in which it causes this. Okay, so for men, sexually transmitted infections can affect the testes of the man. Usually, it will result in what we call orchitis. Orchitis is simply an inflammation of the testes of the man. Okay, so it doesn't end there. It can affect the testes, affect the prostate gland, and also affect the structure we call the epididymis. The epididymis is the structure above the testicle that stores the sperm once the sperm has been produced by the testes. So when this happens, okay, it can affect the quality of the sperm and the quantity of the sperm that is produced. That is number one. Number two, sexually transmitted infections can also damage the tube that carries the sperm. So it can cause obstruction, and this obstruction will limit the quantity of sperm that is produced, that's expelled during ejaculation.
So that's when you say it can affect the quality and the quantity, that's low sperm counts?
Exactly. So it can result in low sperm count, can also cause low sperm motility. So you see a large portion of the sperms are not moving. So what we need to know is that only active sperm can fertilize the egg of a woman. So when a man has a higher proportion of sperms that are immotile or weak, those ones cannot be able to fertilize the egg of a woman. So it needs energy. The sperms, they expend their energy attempting to fertilize the egg of a woman. Because the egg is not just like the egg, there are certain reactions that have to happen. If the sperm does not have the energy enough to, especially reactions like acrosomal reactions. Anyways, I don't want to go down. These are part of this medical whatever. So, but basically, only active sperms can fertilize the egg of a woman. So when a man has a higher proportion of sperms that are immotile or weak, trust me, chances are excellent such a man okay, will find it difficult to impregnate his wife. So this is the reason why the sperm quality and the quantity have to be preserved. And of course, sexually transmitted infections will not allow this to happen. Okay, it will affect the quality of the sperm, affect the quantity of the sperm.
Is it all low sperm counts that are related to
sexually transmitted infections?
Yeah.
Okay, beautiful. That's an excellent question. So not all low sperm count or sperm problems are related to sexually transmitted infections. So there are other causes. There are about 10 to 14 other causes of low sperm count or poor sperm parameters, as the case might be. Conditions like varicocele, genetic conditions, even occupation, trauma to the testes, people with undefended testicles, these are congenital anomalies anyway. You know, exposure to pesticides, like we said, even lifestyle habits, drinking, smoking, using of cannabis, hard drugs, all of these can affect, and then of course, all of these can actually affect the quantity and the quality of the sperm.
Okay. So which STIs or STDs are most commonly linked to infertility?
Beautiful. Okay, so basically, chlamydia and gonorrhea are largely linked to infertility. Okay. But I'm still going to list another. So basically, the causative agents of sexually transmitted infections. Yes, we know they are sexually transmitted infections, but it is because there's a bacteria or a virus or a parasite inside of the bodily fluid. That is what makes it to become an infectious component. Okay. So for the bacteria component now, we have syphilis, we have chlamydia, and we have gonorrhea. Of course, there are still some others that are not so common, mycoplasma and ureaplasma. Okay, but let's just leave that. On the aspect of viruses, HIV, hepatitis, herpes, and HPV viruses are the causative agents, like viral causative agents of sexually transmitted infection. And then parasite, like I said earlier, can be scabies and scabies and trichomonas. These are parasitic agents, okay, that cause sexually transmitted infections. Okay, so now the question, to jump back to the question. Sorry, can you remind me of the question? Which
STIs are STIs are more common with
beautiful with infertility. So the very first on the aspect of bacteria is chlamydia and gonorrhea. Okay. Yeah, the reason, and I will tell you the reason. The reason is because they can be very, very silent. Okay, a woman might have chlamydia and gonorrhea, or chlamydia or gonorrhea, as the case might be. Okay, infection, and then she won't have any symptoms at all. It can even be asymptomatic. That's what we call asymptomatic. Okay?
I'm just trying to cut you. I thought that's the one that, okay, I think that's for the guys that makes them when we hurting them.
They have very painful urination. That's gonorrhea in a man. Yes.
Okay, but in a woman, it's silent.
But in a woman, it can be silent. Yes, she might have this, and it doesn't cause any infection, any symptom at all. No pain, no discharge, nothing, but just in there, silent for years. It takes a while before it now starts to manifest, maybe symptoms, when drops. So, but by this time, while it is there silent, it is not just silent like I was doing, it's sleeping. No, it is doing what we call a silent damage. Yes, resulting in all the scarrings that we're talking about now, the pubic scarrings that would